people see me and they think I'm an alcoholic. People see me, they think I'm on drugs. Especially when I start to shake, other people panic. They want to touch me, they want to help me. I'm like, no, no, no.
So my name is Frederick Belchi. I'm an epilepsy awareness ambassador. I'm also a caregiver of a sister and a wife who lives with epilepsy.
My name is Ndutambo Gori. I am 34 years old. I am a Kenyan, and I have had Parkinson's for longer than I haven't had it, which means that I think even over 20 years ago, we started seeing symptoms and such things, but it has been such an interesting and long journey, just getting a diagnosis and coming to accept the diagnosis and knowing what to do and how to move forward, and yeah, becoming an advocate. It's been a really long journey.
I was diagnosed with epilepsy in the year 2011 while I was working in Iraq as a pastry chef. So I had a tumor in the brain. That is the reason I was diagnosed with epilepsy.
My journey of raising awareness about epilepsy started way back in 2012 when I had to quit my job and to go home and help my mom take care of my sister, who at this point was around 6 years, but she was diagnosed with epilepsy when she was 2 years old. She got epilepsy after suffering from cerebral malaria. Her type of epilepsy is what we call the generalized seizure, which she was experiencing a seizure after every 20 minutes. And this was a very difficult situation and moment to really comprehend as a family.
The journey was quite rough because it took me almost 3 years to accept that I had the condition. So it was very difficult at the moment to know that I was suffering from epilepsy at my age. So I was like, how did I get epilepsy? Where did it come from? So I asked a lot of questions, but eventually I had to settle and accept the fact that I have to live with it and take medication well and trust in God so that I become a better person.
My journey with Parkinson's, I think the reason I'm as, I would say resilient, because it's a word that has been used to describe me, is because I've had it for such a long time that I didn't have any other way to be. I've been depressed, I've been anxious, I've been suicidal, I've been all these things, and that wasn't the end of my journey. And because that wasn't the end of my journey, I had to figure out a way to keep going and to just move forward. And one of the things that actually really inspires me is the advocacy work. I get so fulfilled. I get so much joy from knowing that my struggle is not meaningless. My fight has purpose, and people tell me all the time to try to inspire me so much, and I'm so humbled. I'm so humbled by such words, and that's literally what keeps me going.
It wasn't about even our sister experiencing it, but we as a family. We live in a mission land. I come from Wale, and surprisingly, even my parents and myself were very strong members of the church, and we were given leadership positions. But when we were confronting this condition at some point, we were even taken out of the leadership positions that we are in, because the other understanding about what people think epilepsy is the fact that they think you can do something to your loved one for them to look confused or mentally ill so that you can get riches.
It was also a very big challenge because you lose your friends because probably you go out or maybe you have a seizure, so the next day someone doesn't want to talk to you, you ask them, they say, you know, you have epilepsy and I'm afraid probably it will contaminate me. So those were some of the challenges that I had faced.
It means this is where we are, this is what is there, how do we move forward? Having to lose my identity in a certain way, having to lose my career, because I'm in my early 30s, right? Having to now navigate a whole new path of life, being a very independent person in my past, having to rely on other people, having to be vulnerable, having to ask for help, having to realize what a disability actually is, because there are times I have been stuck on the floor in the house by myself, you know, and my body has just said, we're not doing it today. the pain, the discomfort. It's a lot. It's a lot, but I take a lot of pride in the mental work that I do for myself. I meditate a lot. I talk when I need to. I cry when I need to. I release my frustrations. I journal if I feel mentally overwhelmed. Those are some of the things that just help overcome especially the hard days.
She's now 20 years old and she has been seizure-free now for about 8 years. And that is the motivation behind me now raising awareness about epilepsy. How I do raise awareness about epilepsy, apart from the forums in churches or chief barazas, the opportunities in schools to talk to students and teachers about what epilepsy is, what causes it, and most importantly, the first aid that they can do to a person with epilepsy, is I chose a path of doing extreme sports expeditions.
KEMRI Foundation is an organization based in Kiambu County. We're a chapter of the International Bureau for Epilepsy. We create awareness by empowering people with epilepsy with skills. By empowering people with epilepsy with skills such as beauty skills and computer skills. We also hold regular medical camps.
What keeps me going is knowing that this is not what defines me, right? Outside of that, the support system that I have, my care partner, my family members, the Parkinson's Support Group of Kenya, finding even like a forum like today, being in a room where people understand. People understand. People are not panicking. They're not trying to fix the situation. They're just allowing me to exist in the way that I am. Really keeps me going.